Hi everyone, my name is Dr. Lim. I'm also known as Dr. Xiangjun, the modern traditional doctor. Now I'm on my own practice at 79 Anson Road, level 21. So the reason for me to come out on my own practice is to do my practice of a more integrative settings and also to educate the mass public. So basically my background, I'm trained in Western biomedical science, but also for TCM. I am trained in Beijing. The whole journey for me has been 14 years of study, research and practice. So, and for 7 years, I've spent 7 years full-time in Beijing, China doing the practice and working with various mentors that are high academicians and also those that have lived incognito. So some of the practices that I do have lost their lineages and methods have also been long lost. So I feel that TCM, there's a lot of good things inside which needs to be spread out to the mass public. And currently when I see the situation here in Singapore and also various modernized countries, TCM has been a very commercialized form of practice, and I want to change that situation around and offer the real TCM to people. Also for me to come out on my own practice is to educate the public on TCM, because there has been a lot of stigmatization and misconceptions about TCM, such as TCM is done by old doctors only and only for old patients, which is definitely not true, because for old doctors, look at me, I'm young, but I have the experience, the education, and the execution is there. So, and for TCM, we talk about preventive and health maintenance. So it's not like when you are ill, then you go and see a TCM doctor. It's exactly when you are healthy, we want to upkeep that. That's why we go for regular TCM sessions, just like yoga sessions or any exercise sessions, to keep the flow and circulation good in our body. So for my practice, usually I explain to patients in a very scientific and logical way of how acupuncture works or cupping works, because of my scientific background. However, I'm also trained in various other ancient healing techniques such as yoga, Ayurveda, and some of my diagnosis I've used Chinese metaphysics methods such as Plaza, Feng Shui, and also incorporating other Western alchemy methods, herbalist methods, into all my practices. So also to destigmatize that TCM is rigid, because for me, I will see what is good and then incorporate it in without having to just stick to one form of treatment. So I do a very integrative sort of practice, and every session with me is different, because I believe every session your condition is different, the body will change every time. So there's no two sessions that are similar in my treatment. Also, I feel that TCM, there's a lot of room to grow and to bring it up to a level that is similar in par with the Western medicine, because I think the scientific explanation for TCM is rather poor. But in terms of the research, there are more holistic methods and more well-rounded methods to give this practice a more reasonable and logical kind of research results. So until then, I wish that next time TCM will be brought to a level that is in par with Western medicine, and which is what I am set out to do, to giving a lot of talks and education, educating my patients on a one-to-one basis. And also for me, TCM, I can see that it can be infused into all kinds of industries. So which means that next time I hope that my branding will be infused into various industries such as F&B, restaurants, pharmaceutical as well, yoga, all this. Next time I will believe that TCM will go into a state just like yoga practices. People will do it as part of their lifestyle, which is reasonable, and definitely it will be beneficial to all mankind. And as we progress into the modern society now, as we are more technological based, this kind of ancient healing techniques are losing out, or or people will forget about them, or they may be given a bad name that they are not upkeeping with the technology and the fast-paced society now, which is not true. So that's why, for me, I feel that I am a vessel to hold all these ancient real healings and push it forward into this modernized society. So yeah, that's about it, and hope to see you guys as my patients, or we can share thoughts over in talks and seminars. Thank you.